Taking Ozempic with a sulfonylurea or insulin may increase the risk for low blood sugar. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Some side effects can lead to dehydration, which may worsen kidney problems.
I discovered the potential with Ozempic.
Ask your healthcare provider if Ozempic is right for you.
Well, with symptoms like that, side effects like that, why wouldn't you? My goodness. Let's talk about Ozempic for a bit. First things first, I was at the Habs game over the weekend. On Saturday, I went to the game against the Toronto Maple Leafs, and they had the Ozempic ads on the boards, man. I'm like, my goodness, this thing is everywhere. Last week, La Presse did an expose. They had a journalist that saw ads for Ozempic on social media, and within a few clicks, they were able, just using some lies, telling someone over the internet that they weighed a little bit more than they did and that they were shorter than they were, trying to get their BMI number up. And they were able to get Ozempic shipped to them without ever seeing a doctor. Crazy stories like that lead us to Dr. Christopher Labos, cardiologist, degree in epidemiology, and we're going to talk Ozempic with him. Dr. Labos, welcome back to the show.
Oh, thank you for having me.
Are you on Ozempic right now?
I personally am not on Ozempic right now, but there are quite a few patients who are.
So let's talk about it. Who should be on this? It seems to be taking the mind share of the public like crazy. Who should be on this drug?
Well, so this drug is primarily a diabetes drug, so it is a very effective diabetes medication. So if your blood sugar is high, despite the treatments that you're already on, this is a very useful thing to get your blood sugar under control. And one of the somewhat surprising but very beneficial side effects of Ozempic is that it leads to weight loss. And so people who have obesity and who have medical issues related to that obesity, so diabetes, high blood pressure, heart disease, there is a substantial benefit to be drawn from this medication, because the reason why we talk about weight loss medically is not to conform to society's standard of beauty or anything like that. It's because when you can get people to lose a significant amount of weight, you improve cardiovascular outcomes. And that's why Ozempic has become as popular as it has, because it has been shown to not only lead to weight loss, but also reduce cardiovascular outcomes.
Is this one of those drugs where you have people coming to you and say, hey, I want to get on it? Like, is that what you're seeing? I certainly hear stories of that, but has it reached your offices?
You sort of hear stories about that. There are certain people who have heard of it. The reality is that I often end up bringing it up more often than not. And Ozempic is a weird medication because it has the unique distinction of being both overprescribed and underprescribed at the same time.
Huh.
Because there are definitely people who medically should be on this and can't get it because it is very expensive and it's not covered by Ramsey just for weight loss purposes. And even for diabetes, you have to fulfill a lot of requirements. You have to have failed other drugs. So it's very hard to get it covered, and a lot of people who don't have private insurance simply can't afford it. So there's a lot of people who would probably be on it if it was not covered. But by the same time, there's a lot of people who are abusing it, and that's why that La Presse story was so sort of worrisome, this idea that you could just go on the internet and get it. And you've seen more so in the U.S., not so much here, but, people, because of TikTok and social media, thinking, oh, I can lose 5 or 10 pounds with this medication. That's not an appropriate use for this medication. So that's the thing. It has to be used properly in a medically responsible way.
And on that front, right, this is not just, I take one pill a day magic. This is an injection. This is serious stuff, right?
Yeah, it's a once weekly injection, and it is lifelong therapy because obesity, if you struggle with obesity, like significant medical obesity, it's a chronic condition, right? It's like blood pressure medication or cholesterol medication. You take it to get your risk factors under control. If you stop it, if you stop your blood pressure medication, your blood pressure goes back up. If you stop this obesity medication, you gain weight again. This is the thing. So this is a chronic treatment. It's a risk factor prevention or a risk factor treatment strategy. And I think it's important to talk to people and make sure they understand what we are doing here. This is not something to help you lose 5 or 10 pounds. This is for people who have struggled with their weight their whole lives. And, it's essentially, if you want to think of it this way, it's sort of the medical equivalent to bariatric surgery. Bariatric surgery, again, a very effective way to lose weight and very useful for people who have a lot of weight they need to lose. And there's a lot of debate right now about whether this medication will essentially, quote unquote, replace bariatric surgery in the same way that antacid medications replaced the previous treatment for stomach ulcers, which was having a piece of your stomach carved away surgically. So this is, I think, going to be the evolution for how we treat and talk about obesity. The problem is that in parallel, you're having a lot of, for lack of a better term, nonsense going on in social media, and people trying to abuse the system and get it through illicit means.
And to wrap up, I do want to focus on what you mentioned before, the people that should be on it, but they're not right now. So who do you, let's go through a profile here maybe of people that are listening that should actually be doing that thing that we hear all the time. Talk to your doctor about. Yeah. Who should be doing that?
If you have uncontrolled diabetes, this is a very good diabetes medication. And in that case, it probably could get covered by RAMQ if you don't have private insurance. But if you have obesity associated with other health problems, but even alone, if you have very high obesity, I think the cutoffs are a BMI of over, I want to say 40, that would be an indication to get it done, to start on this medication. So you have to be willing to pay for it, or you have to have private insurance. But if you have obesity and you want to prevent the long-term complications of that, this is a medication that could be prescribed, provided you don't have some of the contraindications like a family history of thyroid cancer or, a few other rare medical situations where you shouldn't prescribe this medication.
And this drug, it's been sufficiently it's been out for a while because it's a diabetes drug, right? So this is, I know it seems like it just came out of the blue, but it's actually been around for a little bit longer. Like, you feel it's sufficiently vetted by now?
Oh, yeah. I mean, people don't realize there's been almost a dozen studies on Ozempic, and that's because I think that company realized that it was going to be effective and big, and that's why they've tested it in multiple different situations. So they tested in people with diabetes, people without diabetes, people without heart disease, people with heart disease. 2 trials just came out at the American College of Cardiology just past weekend about treating it in people with heart failure. So they have studied this. I mean, this medication does work. It just has to be used responsibly, and the problem is I think a lot of people are using it in an irresponsible fashion.
Dr. Labos, what are you doing for the eclipse?
I am hopefully going to finish my workday, but then I have my glasses ready to go, so I'm going to pop outside and take a look at the sun as it slowly disappears.
I hope you enjoy it, and there goes my laptop, by the way. Apologies. Dr. Labos, be well. You're always welcome on the program.
Take care, man.
That's Dr. Christopher Labos, cardiologist, degree in epidemiology. You hear him all over the CJAD schedule.